Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So, friends, as we know, we are discussing about different aspects of history taking. Almost all 18 videos I have already posted regarding the details of history taking, so that we should not commit any mistake in history taking part. So in the last video, I have explained about the pathological diagnosis, how to make a pathological diagnosis. After thorough history taking, we used to collect all the points, positive points, including age, sex, and the main complaint, present complaint, past history, any significant, and present history, the details of the disease. You collect all the details, then you go for anatomical diagnosis, and after the anatomical diagnosis, you go for micro anatomical diagnosis. Once this anatomical diagnosis is over, then you go for pathological diagnosis. Now, once the pathological diagnosis is over, the next step that we have to do is etiological development, etiological diagnosis. Etiology in terms of Ayurveda, when you say etiology, means karana. We know that karanam rupam karyamiti krutva. So there should be particular karana for each and every karya. So therefore, if the disease is manifesting, if any symptom is developing, definitely there is also one karana. So now, what is that karana? Okay, so that has to be identified, and that will be the third stage of diagnosis. First, anatomically we have done, then pathologically we have done. For example, a disease of the respiratory system, disease of the lung parenchyma, and pathology is inflammation. So inflammatory disease involving the lung parenchyma of the respiratory tract. So this is up to now we have done anatomical and as well as pathological diagnosis. Now we have to find out what is the cause for that. Okay, it is inflammation. Okay, it is respiratory tract. Okay, it is lung parenchyma. Why it is happened? That comes under the etiological development. So when you talk etiological development, etiological diagnosis, first you have to identify the etiology. Sometimes etiology may be infectious, isn't it? Etiology may be non-infectious. Etiology may be allergic. This is now etiological. Okay. Similarly, etiology may be congenital or etiology may be acquired. So that also you have to identify whether this particular problem is a acquired problem, whether this problem is having congenital problem, or whether this problem is chromosomal problem. Now, etiology may be nutritional. The problem is because of a nutritional problem. It's a nutritional etiology is a nutritional problems. Etiology may be iatrogenic. It may be because of the iatrogenic problems, maybe some of the mistakes committed by the physician or during the procedures, etc. It may be iatrogenic problems, or it may be some problems committed during the panchakarma procedures, iatrogenic problems. Etiology may be deficiency. The whole phenomena, whole pathology, everything is happening only because of deficiency problem, just like in malnutrition, vitamin deficiencies, etc. Etiology may be environmental. So many environmental allergic environmental problems, sound pollution, some of the psychological problems, maybe because of the environmental problems. Okay, some of the allergic disorders, maybe because of environmental problems. Some of the diseases, maybe infectious disease, maybe because of environment problem. Sunstroke, heat strokes, okay, cold stress. So there may be environmental problems. Okay, then some of the problems may be allergic, we have already discussed. Some of the problems may be radiation, and some of the problems may be drug related. Problem may be drug. For example, a patient of tuberculosis comes to you with the arthritis. Okay, come to you with the arthritis. He is a known case of tuberculosis. The disease, we know that disease is related to the respiratory tract, suppose, and the pathological diagnosis, we know that it is inflammatory. Now, if you come to the etiology, what is the etiology? Etiology in that case is drugs, because one of the common adverse effects of all the anti-tubercular drugs is arthritis. Maybe I am giving one example. So even the drugs may be some of the etiology. Nosocomial infections, hospital acquired infection, that is also one of the etiology. Occupational hazard, again etiology. Okay, similarly contaminating disorders, again the etiology. So now in this particular phase, we have to identify what is the actual etiology of the disease or symptom. Similarly, we have got so many other etiological. Now this is because even Ayurveda also give more importance for Nidana Panchaka. In that Nidana or Karana has been given more importance. So Karana we have to identify. The disease may be epidemic, disease may be endemic, disease may be sporadic, or even pandemic. Okay, disease may be chromosomal. Suppose in the history, if you find something very special in the family history, In the family history, they are telling that so many members of the family are suffering from similar type of illness. Then when you come to the etiological diagnosis, this particular point is very important. It may be chromosomal, teratological, because of the adverse effects of the drugs. It may be geriatric problem. Okay, senile choreas. Okay, that is a geriatric related problem. Okay, Alzheimer's disease may be. Okay, it may be geriatric related problem. Senile cough, the geriatric related may be. Next, traumatic. Sometimes it may be traumatic. Sometimes it may be toxic effects. Again, etiology. Sometimes it may be autoimmune. Now, autoimmune is also pathological and autoimmune is also etiological. Okay. Now, sometimes it may be because of immaturity. Etiology is immaturity, just immaturity, as happens in case of newborn babies. Okay. Or gestational age related, premature babies, low birth weight babies, etc. Sometimes it may be, etiology may be socio-economical. Patient suffering from some personality disorder. Patient suffering from psychological problems. Patient is suffering from nervousness. Again, it may be socio-emotional or stress-related problems. Again, the etiology will going to change. So like this, after taking this history, now you have to make this particular etiological diagnosis. This is very important. So suppose if I say a patient is suffering from a disease of the upper respiratory tract involving the lung parenchyma, which is having inflammatory pathology and cause being a infection, or cause being a nosocomial infection, or cause being a some other epidemic problems, cause being immaturity, maybe. So this is how you have to proceed. Okay. Now, when you see into the look into the etiological diagnosis, is again almost all the repeat. Now, in case of etiology, when you talk, whenever one more important thing is acute or onset. This part also comes in this particular concept. Again, you have to recheck whether this problem is acute or chronic. If the problem is acute, okay. Now, as I told earlier, there are only 6 causes for acute causes. If any problem started very acutely within one day, within few hours, within minutes, okay, or within few hours, then always there are only 6 causes. What is that? One is it may be a vascular problem. It may be a vascular problem. You know, paralysis. Paralysis occurs in minutes because it's a sudden. That means it is sudden onset. Sudden onset means there is some vascular problem. It may be because of the thrombus. It may be because of embolism, or it may be because of the rupture of the vessels, or it may be because of the hematoma. Vascular problem, or it may be because of edema. Okay. Then one is it is vascular. Another one is it is allergic. Allergic starts very suddenly, or it may be metabolic, starts suddenly, or it may be toxic, starts suddenly, or it may be drugs, again starts suddenly, or mechanical, any other obstructions, etc. So whenever you get an acute cause, always think about it. When you get ultra rapid cause, ultra rapid fast, for example, very, very fast, foreign body inhalation most of the time, okay, or sometime some of the immunological problems, this anaphylactic shocks, etc. Okay, so they may be ultra rapid, but when you talk about acute, there are 6 causes that you have to always remember. If it is not acute, chronic, it is coming over slowly over 1 month, then you have got a lot of chronic causes. Etiologically, we have got a lot of chronic causes. It may be congenital, or it may be chromosomal, it may be hereditary, or it may be familial tendencies, or it may be nutritional, or it may be inflammatory, non-infective inflammation, autoimmune causes. So they start little slowly compared to the acute causes. Okay. So this is again one more important thing. Now, if you look into the same etiological diagnosis in terms of Ayurveda, we know that Karana has been given more importance, because we always believe that there is something is there. We cannot say that the idiopathic origin or disease of unknown origin. So such terms are not there in Ayurveda, because we believe that Karanana Rupam Karamete Krutva. If some Karya is going on, taken place, that means definitely there is one Karana. That Karana may be visible, that Karana may be invisible, as in case of Graha Rogas. Okay, Graha Rogas, yes, the disease is there, manifestation is there, but causes are not visible. But Karana is there, but it is invisible. That's all. Anyway, so in etiological diagnosis in terms of Ayurveda, we have to look into Nija or Agantuja. Is it Manasika, or it is Swabhavaja, or it is Vajaja? Again, senile causes, natural causes, psychological causes, infective causes, or external causes, and inside Nija causes. Nija may be related to the body. What is related to the body? Most of the time, the immunological problems. Next, whether the cause is Sahasajanya, whether the cause is santarpanajanya or whether the etiology is santarpanajanya, whether the etiology is apatarpanajanya. Okay, so whether the cause is Vaidyakrita, whether the cause is Vegadharanajanya. See, these are all the etiological diagnosis point which has to be understood in terms of Ayurveda. Okay, Rutu Viparitajanya or Vaiparithyajanya, Viruddhaharajanya, Kuposhanajanya, Kshayajanya, Sahaja or Anushangi. Then whether it is Abhigataja, Abhishapaja, Abhicharaja or Abhishangaja, whether it is Bhutabhishangaja, whether it is Papa Karmaja, whether it is Atma Karmaja, etiology, chronic etiologies. Okay, Purva Janmakrita Papas, chronic etiologies. So, what do you say for chromosomal problems? Isn't it? A patient is having Down syndrome, diagnosed Down syndrome. What is the etiology? Of course, we know the chromosome. So, what is the cause? That is a Purva Janmakrita Papa, that's all. Otherwise, what is the sin of that particular baby? Isn't it? Now, some other points like Sadhyaja, some other etiology like Sadhya, very acute causes. Okay, Chirakalina or remote, very distant causes. For example, Rudrakopa. Similarly, whether the disease is Satata, etiology, Santata, whether the disease is Sapratyanika, Nishpratyanika, not related to Rutu and daily diurnal changes, but related to diurnal changes and dosha visheshan of the day and night. Sapratyanika and Nishpratyanika. Whether it's Janapado Dvamsaja, whether it's Krimija, all these are, whether it's Mrudbhakshana Janya, these are actually etiological diagnosis. Etiological diagnosis. Okay, so this is actually all about the etiological diagnosis, third step. The last step is functional diagnosis. So anatomical is over, pathological is over, and etiological diagnosis is over. Now last one is functional diagnosis. Now yes, okay, there is anatomy is involved, pathology is involved, there is also cause identified. Now which function of the bodies get affected because of which this problem? Which function of the bodies get affected? We have got different dhatus doing different function, different doshas doing different function. Out of which function is get affected? Okay, so immunological functions are get affected. Do you think? Or nerve conduction is get affected? Now this is functional diagnosis. Okay, rhythmicity of the heart is get affected. Oxygenation process is get affected. Circulation is get affected. Pumping of the heart is get affected. Metabolic functions are get affected. Musculoskeletal movements are get affected. Cognition is get affected. Lingual speech is get affected. Orientation of time and space is get affected. Higher mental functions are get affected. Equilibrium is affected. See, these are functions. Equilibrium is get affected. Now you have to go for functional diagnosis. Now, if I go with the same thing, what a patient is suffering from fever, cough, and as a breathlessness. Now, suppose my diagnosis will be at the end. How I have to read? This is a disease of respiratory tract. This is a disease of the lower respiratory tract. This is a disease of the lung parenchyma. Anatomical diagnosis is over. Patient is suffering from a disease of the respiratory system affecting predominantly the lower respiratory tract involving the lung parenchyma. Okay, because breathlessness is there. Next, the pathological diagnosis is mostly this is an inflammatory disease. Infective, you have to be very specific. Infective inflammatory disease. Pathological diagnosis is over. Okay, come to the etiological diagnosis. What may be the etiology? Why this happen? Okay, so we know that what are the different points that you have to consider in the etiology. Just previously we have seen etiological diagnosis. What are the previous points? Do you think it is a nutritional, iatrogenic, deficiency, environmental, allergic, nosocomial, occupational? Okay, so etiology may be nosocomial infection, or etiology may be some of the contaminating disorder, or etiology may be inflammatory. Etiology may be inflammatory, or etiology may be inflammatory. Okay. Now come to the last, functional diagnosis, because of which breathlessness is there. So what is get affected? Oxygenation function is get affected. So functional diagnosis is oxygenation is get affected. Therefore patient is having breathlessness. Now this will be the complete package of the diagnosis. Patient is suffering from the disease of respiratory tract. There's a lower respiratory tract involving the lung parenchyma, which is inflammatory in origin. Pathologically it is inflammatory, and etiologically again it may be nosocomial or occupational or environmental, and affecting the oxygenation of the person or child. This is the complete package of diagnosis. Next we will go for differential diagnosis. This is the total summary. This is how we have to write the diagnosis only by using history taking, isn't it? We have not looked into the examination. We have not gone for the systemic examination or general examination. Nothing has been done. We have not even seen the pulse also. Vital signs are also not seen. Only on the basis of the history we are doing all these diagnoses. Now what is left? You have to confirm your diagnosis by general examination, systemic examination and investigations. So this is all about this particular diagnosis. Thank you very much. We will meet again with another class, and don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.